Hello and welcome to True Pathfinder, your portal to health and truth. And in this video, we're going to look at the hidden cause of many chronic diseases, namely mycoplasma. So let's explore together. What is mycoplasma? What diseases does it cause? Which are the symptoms you have to look out for? And most importantly, how can we treat it successfully in a natural way? Let's explore. We have to ask ourselves, why do we see so many people in North America suffering from multiple chronic conditions? Why are so many diagnosed with Lyme disease, chronic fatigue syndrome, rheumatoid arthritis, cancer, diabetes, cardiovascular diseases, respiratory diseases? The list goes on and on. Why is also the medical and pharmaceutical industry not able to find successful treatments to reduce this terrible suffering? Why do we also encounter a less virulent and easier to treat diseases in Europe and other parts of the world? And we see some conditions in the US and Canada that are not even known on other continents. Well, to better understand this, we have to look at mycoplasma and its history. Mycoplasma has been spreading tremendously since 1960 and is today one of the fastest growing epidemic vectors. And in order to understand mycoplasma's history and what exactly it is, better we're going to look at the work of Professor Emeritus Dr. Garth Nicholson. There are three main factors that contribute to this new epidemic. First one is the tremendous overuse of antibiotics over the last 70 years. Second is the extreme ecological disruption that humans are exposed to, especially with an increasing population and food globalization. And then we have also the bioweaponization of specific infection vectors used by the military-industrial complex and the pharma industry. In the last 65 years, all these actions have led to an aggressive diversification of the most resistant and potent bacterial group that is known as proteobacteria. This group of pathogens includes Mycoplasma, Bartonella, that we have discussed in our last presentation. If you haven't watched it yet, please do so after this one. I'm going to link it down below. Brucella, Ehrlichia, Anaplasma, Rickettsia, Klebsiella, E. coli, Pseudomonas, Salmonella enterica, which causes the typhoid fever, Chlamydia, Shigella, Yersinia, Helicobacter, Campylobacter, Borrelia, and many, many more. Most pathogens are also identifiable as Lyme co-infections, and they contribute significantly to the Lyme patient's symptoms. The treatment methods used by the medical school are 50 years old and have not been adapted to these new aggressive microorganisms. In universities, nobody teaches the science about reducing the cytokine cascades, boosting the immune system, and the mitochondrial respiration. Equally important is the health of the immune system. The outcome of interactions between different infecting vectors is firmly dependent on an individual's immune system health, but also environmental factors and lifestyle, timing, and the sequence of the infections. Therefore, it is always crucial to boost the immune system of the patient and support mitochondrial activity. The impact of multiple co-infections is not additive but synergistic, meaning that it creates effects that are more than their sum. For example, infection with Babesia and Bartonella can reduce the red blood cell count by 25%, which leads to anemia, fatigue, breathlessness, and general weakness. However, Babesia bacteria tend, over a longer period of time, to clear the Bartonella bacteria. In the initial stages, the expected impact on the red blood cells is, however, immense, and they also have a very severe effect on the spleen and the liver. Infections with Anaplasma make subsequent infections with Babesia much easier. Ehrlichia infections combined with Bartonella or Babesia are often more severe, and in this case both the red and the white blood cells are compromised. Patients that are co-infected with Mycoplasma and Bartonella will show severe symptoms in their endothelial cells, the red blood cells, the brain, and the central nervous system that are out of proportion compared with singular infections, and in this case the cytokine cascade must be firmly controlled to avoid seizures. As you can see, it is imperative to diagnose the co-infections correctly in order to modulate the therapy and significantly reduce the inflammatory process, and also in order to set up the correct therapy protocol and adjust it accordingly. And that is what we do here at Christine.doctor. Link in the description box below, so please do not hesitate to contact us and we will take care of you. Now let's look at Mycoplasma specifically in more detail. But before we do that, short reminder, if you enjoy our content, please support us directly by becoming a Patreon from as little as $5 per month. Link is in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. Also, I recommend that you take advantage of our current sales action and get 4 amazing holistic health tools at vibrantbody.net at considerably reduced prices and with free international shipping. This offer is only valid until the end of the year, so you have a little bit over a week still to go. Take advantage. Link is also in the description box below for you, of course. So what is Mycoplasma then? It is the smallest and simplest self-replicating bacteria. The Mycoplasma cell contains the minimum organelles that are essential for growth and replication, namely a plasma membrane, ribosomes, and a genome that consists of a double-stranded circular DNA molecule. Mycoplasmas have no cell walls and are placed in a separate class that is called mollicutes. Mollis that comes from soft. Cutis means skin, so soft skin. Not having a cell wall makes the Mycoplasma utterly resistant to many antibiotics. Mycoplasma is self-replicating. It requires cholesterol for membrane functions and growth, and it depends strictly on the host nutrients, which they scavenge permanently to survive. They have specialized organelles that mediate their intimate interactions with the eukaryotic cells, that is achieved by surface parasitism, and in this way they can survive for very long periods in the same host. Mycoplasma is a gram-positive bacteria. It's very tiny. Just to give you a better idea, 4,000 mycoplasmas fit in 1 red blood cells, while only 12 Bartonella bacteria can fit in 1 red blood cell, with a diameter of 6 to 8 micrometers. Mycoplasma fermentans is the primary culprit for 45% of all Gulf War veterans who were never treated correctly, unfortunately, for their conditions, the Gulf War syndrome as it is called. And Mycoplasma is also the major player in many chronic diseases such as AIDS, ALS, Alzheimer's, Lyme disease, rheumatoid arthritis, cancer, fatigue syndrome or chronic fatigue syndrome, autoimmune diseases, autism, MS, and many more, such as diabetes 1, Crohn syndrome, Parkinson's, collagen vascular diseases, etc., etc., etc. How do you get infected by Mycoplasma then? Well, the bacteria are spread by biting insects, such as ticks, mosquitoes, fleas, and biting flies, but also sexual contact, contaminated foods, and airborne droplets. More or less everyone has been exposed to some form of Mycoplasma. There are over 200 known types of Mycoplasma that can infect both animals and plants, and us humans of course. Mycoplasma is highly adaptable and can jump and adapt to the new host very rapidly. And there are at least 23 different varieties of Mycoplasma that can infect us humans. A few are considered harmless normal flora, but some are very aggressive pathogens such as Mycoplasma fermentans. And they were supposedly, this species was supposedly artificially designed by combining Brucella bacteria nucleus with Visa virus. And this was tested on inmates in Huntsville, Texas, in the prison there, with disastrous health effects for that region. Dr. Maurice Hillman, a chief virologist at Merck, added Mycoplasma strains to all vaccines he created, causing thereby most likely the AIDS and chronic fatigue syndrome epidemic. Dr. Shi-Ching Law, a senior researcher at the Armed Forces Institute of Pathology, studied also Mycoplasma as a bioweapon. There is a patent on this even, and this was used in the Gulf War. And therefore, our statement, and not only our statement, but other doctors agree with us that Mycoplasma is probably the primary culprit for the Gulf Veterans Syndrome. Dr. Charles Engel, who was with the U.S. Institute of Health in Maryland, stated on February 2007 the following: I am now of the view that a probable cause of chronic fatigue syndrome, fibromyalgia, AIDS, MS, and many other illnesses is the Mycoplasma infection. I have all the necessary documents to prove this. Most infected people are in the US and fewer in Canada, and nowhere else has this Mycoplasma affected a population to the same extent. Now, those of you who are sufferers of chronic Lyme disease are very familiar probably with the terms Babesia, Bartonella, and Ehrlichia. Unfortunately, these are not the only co-infections that we see in chronic Lyme patients. Mycoplasma co-infections are lesser known by Lyme patients and are often overlooked by doctors, and therefore it is imperative to shine a light on this Mycoplasma co-infection. The symptoms of these Mycoplasma infections are highly variable, unspecific, and therefore often overlooked. However, there are some symptoms that are typical for the Lyme co-infection with Mycoplasma, and those are chronic fatigue syndrome, chronic joint pain, headaches, intermittent fever, nausea, gastrointestinal problems, recurrent diarrhea, visual disturbances, memory loss, sleep disorders, skin rashes, joint stiffness, depression, irritability, night sweats, concentration loss, muscle spasms, nervousness, anxiety, chest pain, breathing irregularities, balance problems, vertigo, light sensitivity, hair loss, urination and bladder problems, congestive heart failure, blood pressure abnormalities, lymph node pain and inflammation, persisting coughing, eye pain, floaters in the eyes, etc., etc. And unfortunately, many of the symptoms are wrongfully allocated to the Borrelia bacteria, when instead their primary cause is very often the Mycoplasma bacteria. In North America, Mycoplasma fermentans, designed mycoplasma as we have discussed, or created in the lab, and Mycoplasma pneumonia are the predominant species. Mycoplasma hominis is more prevalent in Europe. Generally, most patients with chronic fatigue syndrome have Mycoplasma infections. However, Lyme patients have an even more substantial prevalence of Mycoplasma of about 75%. Over 50% are infected with Mycoplasma fermentans and about 25% with Mycoplasma pneumonia. The rate of Lyme patients infected with Mycoplasma surpasses that of Bartonella and at 25 to 40% and that of Babesia at 8 to 10%. People with a sound immune system and a healthy lifestyle can deal with Mycoplasma infections. How can we figure out if a patient is infected by this Mycoplasma? Well, unfortunately, reliable tests for Mycoplasma are not available on the market, but we do offer at Christine.Doctor DNA scans to identify the Mycoplasma infections and infections with hundreds of other pathogens with very high accuracy. For doctors and professional health givers, we highly recommend using EDS testing. Our EDS system, called Visron, together with the Homopath software, diagnoses Mycoplasma and many other pathogens very successfully. I'm going to link the Visron system down below for you. In chronic Lyme disease, it is often difficult to know which infections are responsible for the persistence of the condition. The chronic intracellular conditions that change the cellular metabolism and suppress the mitochondrial functions will lead to patients remaining chronically ill, and therefore these infections must be aggressively treated. And we have scientific evidence that Mycoplasma bacteria are associated with microparasites. Their infection, their proliferation, and their development stages occur in the same way. Namely, in the first stage, they are within your vessels, and it's called the intravascular stage, followed by the extravascular phase, and where they invade the connective tissue, and finally the stem cells, and where they destroy them by that. Now that we have gained a better understanding of Mycoplasma, the symptoms, and why it is very important to treat it and to diagnose it firstly, of course, and treat it successfully, let's see how we can do that. Mycoplasma therapy is complex and it takes quite a while. It takes about 6 to 8 months until all of the symptoms subside. The protocols can be very varied and they can depend considerably on the patient's immune state and the symptoms. In this video, I present to you Mycoplasma therapy, a general approach to treating Mycoplasma naturally and holistically, but it has to be said that this therapy plan must be customized to each patient's needs, and that's why you need a qualified professional such as us at Christine.Doctor. Again, please do not hesitate to contact us. Link is as always in the description box below. We need to bathe the body in counteractants to the Mycoplasma cytokine cascade and membrane proteins for a long time to turn this physiological condition around and to make the cellular environment unpleasant enough for the Mycoplasma bacteria. And the treatments that we need to apply to achieve that is we replace the nutrients that are scavenged by the Mycoplasma. We reduce the specific cytokine cascades that the Mycoplasma has initiated. We boost the immune system and the mitochondrial function. We support and repair the organs and take care also of the neuronal cell damages. We also take care of specific symptoms of the patient and support a lymphatic system and the liver by detoxifying it. And to achieve that, we have a herbal protocol that we have developed. We use the Herbessa Mycoplasma antibacterial, a proprietary blend, also vivid artemisinin, 40-day therapy, and we combine it with many other antibacterial herbs. Then we also use the Herbessa immune booster, the Herbessa mitochondria energy boost, the lymphatic and liver stimulation, and the Herbessa cytokine stop, and other natural remedies. And here's a list of other natural remedies that we use depending on the specific symptoms of the patients. For urinary tract infections, we use uva-rc, phellodendron, berberine, and bidens. For cervix and vaginal infections, berberine, tea tree oil, uva-rc, local douche there. For lung infections, bidens, pleurisy root, licorice root, L-campaign root, yerba santa, and lomasium. For severe anemia, Sida acuta and bidens. For severe central nervous system infections, motherwort, greater celandine, and kudzu. For severe neuronal cell destructions, Chinese skullcap and lion's mane. For severe neuronal pain, the greater celandine, kudzu, and theramine. For anxiety and panic attacks, pasque flower, motherwort, and coral root. For sleep disturbances, melatonin and 5-HTP, as well as ashwagandha and motherwort. For severe fatigue, a herb farm formulation called Eleutherococcus, as well as rhodiola, schisandra, and motherwort. For rheumatoid arthritis, greater celandine, olive leaves, berberine plants, ashwagandha, green tea, and teasel root. For extreme weight loss, shiitake mushrooms, lentil extract, and fermented non-GMO organic wheat germs. As I have mentioned already, the mycoplasma bacteria utilize many of your body's nutrients, and therefore replacing these nutrients is very important. Replenishing these depleted nutrients can be done by combining adequate nutrition with selected supplements and herbs. In our opinion, the ketogenic diet is the best one to choose in this case, and the supplements that we recommend are B vitamins, because they are deeply scavenged by the bacteria, choline, 500 milligrams daily. You can get choline also by eating eggs, dark chocolate, and peanuts. Zinc, 50 milligrams daily. They are also contained in sesame seeds, pumpkin seeds, watermelon, and garlic. Copper, 2 to 5 milligrams daily. Can be also found in liver, oysters, and seeds. Selenium, 200 micrograms daily. Can also be found in eggs, mushrooms, poultry, onions, and certain grains. Amino acids. All of the amino acids in different amounts per day. Fatty acids. Here, to get the required amount of fatty acids, you can consume coconut and olive oil, about 250 grams daily. And an RNA/DNA complex at 500 to 1500 milligrams daily. This can also be found in chlorella and spirulina naturally. And we also have some amazing holistic health tools that can help us. Bioenergetic therapy tools. First on the list is galvanic therapy. It's the most important and most potent to treat mycoplasma infections. And here we have two amazing galvanic therapy devices that I'm also going to link down below for you. And you can find them as all of these devices at vibrantbody.net. namely the Ionotrans Essential for personal home use and the Ionotrans Expert for professional use. Also very helpful is microcurrents therapy, for example with the Diamond Shield crystal. That is, by the way, right now on sale. Link in the description box below, of course. To recover, to detox, and to help restore the functions of the different cells, tissues, and organs, we recommend photon and laser therapy systems such as the ULD 117 for doctors and the TMA 717 for private users. TMA 717 is also right now on sale, so take advantage. Link, as always, as mentioned, in the description box below for you. To improve the lymph and blood circulation and to ameliorate some of the symptoms and relieve the pain, we highly recommend the Aquatone Professional. And to restore the autonomous nervous system balance and trigger autoregulation, we recommend the exceptional systemic biofeedback device called the Kindling Easy, which is automated and, as the name already suggests, very easy to operate by consumers as well as doctors. Time for conclusions then. What have we learned? We've seen that the Mycoplasma epidemic is real and over 85% of the North American population is affected. We've also learned that mycoplasma infections manifest with many different symptoms and predominantly appear in chronic fatigue syndrome, Lyme disease as one of the major co-infections, respiratory diseases, Gulf War syndrome, cancer, Alzheimer's, cardiovascular conditions, neurodegenerative diseases, urogenital diseases, as well as many more. Mycoplasma is a ubiquitous bacteria of the Proteobacteria group, a very tiny pathogen with no cell walls that penetrates the red blood cells and transmits its DNA to the host. From the 200 known Mycoplasma specimens, about 23 are infectious for humans and very aggressive, and as we have seen, also quite difficult to treat due to the diversity of the symptoms. The most important ones that are harmful to us humans are Mycoplasma fermentans, Mycoplasma genitalium, hominis, penetrans, and pneumonia. As we have also seen, Mycoplasma is very often the primary cause of diseases such as chronic fatigue syndrome, joint pain, headaches, intermittent fever, nausea, gastrointestinal problems, recurrent diarrhea, etc., etc. Often, we have discussed this also in the course of this presentation, these symptoms are allocated to the Borrelia bacteria, when instead the Mycoplasma is the main cause. Diagnosing Mycoplasma is complex, and there are no lab tests that are reliable offered right now on the market, but as I've told you in the course of this presentation, we do offer a holistic health assessment that takes place remotely, which can determine the Mycoplasma infection quite successfully. Contact us please at christine.doctor for that. The Mycoplasma therapy is multifaceted and must be customized to the patient's specific symptoms. A vital role is played by the supplements that we use to replenish the body, because the Mycoplasma lives on our nutrients and depletes the nutrients from our cells. And we have seen that we have developed a proven natural therapy program to eradicate the Mycoplasma bacteria successfully, to reduce the cytokine cascade and support and boost the immune system and the mitochondria, and also to take care of the specific symptoms that most often appear in Mycoplasma infected patients. This kind of therapy, as you've seen, can also be very well supplemented and supported by different bioenergetic and phototherapy devices. And we do offer mycoplasma treatments along with the natural remedies and the bioenergetic systems at christine.doctor and vibranbody.net, as mentioned. It is essential to test and treat all Lyme disease patients for mycoplasma because, as we have seen, more than 75% suffer from this co-infection. With all that being said, I hope that you've enjoyed this presentation. If you did so, please support us directly by becoming a patron from as little as $5 per month. Link is also in the description box below. And also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. Thank you very much for your attention, and until next time, stay healthy.